The CCT is the completion of training certificate. And again, it doesn't mean that after this, and Dr. Akasha now confirmed the message that I was giving yesterday, it makes you an eligible candidate for a substantive consultant post. It doesn't guarantee a substantive consultant post for you. The same for Caesar. So you are saying, well, my training is equivalent to your training, and then it will be assessed. The specialist registration, this is what you're looking for if you are planning to be a substantive consultant. So you cannot get a job of substantive consultants, and there is a difference between substantive and other consultants, if you're not on specialist registration. So you need the specialist registration if you want a substantive consultant post. Now, the ILR is the indefinite leave to remain, which means you are not linked to a hospital which gives you the visa. So again, you need to understand this because it affects your decision whether you need a hospital from the NHS to sponsor you for your visa till you have your ILR. Once you have ILR, then you don't need sponsorship, and then you are not attached to the NHS hospitals if you want to leave them. The management team, the hospitals are run by management team. It is not run by doctors. So doctors have their sayings in the planning, but the management are not doctors, okay? Substantive consultants mean you are a fixed consultant in this place forever, and it means forever as long as you don't have, you know, a problem with the GMC registration, or you don't have any, you know, medical registration problem. But substantive means you stay in this place forever if you want. A fixed term consultant, this is the point. So to have a substantive consultant, you need the specialist registration, either CCT or Caesar. But you can work as a fixed term consultant. A fixed term consultant means you are signing a contract with the hospital, an NHS hospital. Still, they are sponsoring you for a visa till you have your ILR. But when you sign this contract, it needs to state a fixed term. So it's a fixed term for a year or two. And then it is renewed. So it is similar to the contracts in the Gulf area. So what does it mean? You are signing a contract for a year, and they are sponsoring your visa for a year, and then you renew or sponsoring your visa for the next few years. But then you renew your contract with the same hospital every year, as long as you agree and they agree. So we've seen fixed term consultants in the same hospital for 15, 20 years, that's no problem, okay? Now the salary is similar to the substantive consultants, and the way they are treated is exactly similar to, okay? So there are also specific laws here in the country for the fixed terms employees. So this type of consultancy, you are a fixed term, not substantive. You don't need to be in a specialist registration. You can have it with your regular full registration, okay? The other type of consultancy are locum agency. So you register with a locum agency, and then you can be in the hospital with a fixed term contract, but usually it is up to 6 months, okay? And again, it is just renewed every 6 months. We've seen some locum agency consultants doing their job in the same hospital for 3 or 4 years. So do not ever think that, well, locum agency consultants, they will travel and there's no stability in your life. No, you can still do it, okay? The difference between locum agency consultant and the fixed term consultant, that the locum agency, you cannot do this before your indefinite leave to remain. So you cannot have the locum agency because you are employed by the locum agency, not to the hospital. So you cannot do this type of work unless you have your ILR. So what is the benefit of this type of work? It's, of course, the payment is much greater than the other types of consultants, okay?
Dr. Mahmoud, we are shortage of time and we will have more detailed description. So just 1 or 2 minutes and then we can move to this next session.
I will try.
Because we have detailed training, we have detailed fellowship, we have detailed,
so for the specialist registration, we discussed the training route, and the Caesar route will be discussed in the Caesar session. And there's the non-training or the white gray band, the fixed term consultants. Again, you don't need the specialist registration, the locum agency consultant, and then currently there is increase in the work demand for the independent sector working for NHS. For example, in ophthalmology, something like Rabie in Egypt, it's a private sector, but they take contracts from the NHS. So the workload is also high, and they need consultants, they need surgeons, they need doctors. Again, this type of work cannot be done without your ILR. So to prepare yourself to be a consultant in any of these types, you need your qualifications to be equivalent to the other consultants. You need the clinical and surgical experience and management, leadership, teaching, and research. These are the points that you need to prepare. And then after having this, it depends on your the way that you think. Is it working for NHS full-time? Is it working for NHS part-time? Or you can work outside, totally outside the NHS. It means more payments, but theoretically less stability, okay? Or you can shift your career totally. What makes you a good, competent consultant? This is very important. It's not just to be a consultant, it is to be a competent consultant, and there are certain points that need to be fulfilled. And I think this is the last slide. Thank you so much. Questions, if there is any.